The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem. Welcome everyone. Thank you for joining us today. My name is Stefanie and I'm part of the team here at MyVirtualPhysician. We are a direct-to-consumer, multi-specialty telemedicine provider operating in multiple states. Welcome to Talk Tuesday as we are continuing our weekly educational series talking with our expert physicians, exploring some common healthcare concerns, and hopefully answering some questions that you may have. Today, our physician expert is Dr. Salome Masghati, a practicing gynecologist and minimally invasive surgeon who is one of our telemedicine providers. We're talking about a complaint our doctors commonly see or treat, and that is a urinary tract infection or a UTI. So, Dr. Masghati, thank you for joining us today.
Hello.
So let's cut to the chase. Can cranberries cure UTIs?
Many people believe that cranberries or cranberry juice can treat a urinary tract infection, but the answer is it's complicated. There have been many studies on cranberries as a UTI treatment, and research has shown that an active ingredient in cranberries, which we call proanthocyanidins, which is really a tongue breaker, we call it PCAs for short. Those ingredients are effective in preventing E. coli bacteria, which is the most common cause of UTI infections. These ingredients can prevent those E. coli bacteria from attaching to the bladder wall and colonizing or creating an infection. So PCAs or cranberries may help prevent a UTI, but once you already have an infection, that treatment is not effective. A cup of cranberry juice may only contain a small amount of this active ingredient, but has tons of sugar. So cranberry tablets or pills will be a better option for preventing a UTI.
That makes sense. So if someone wants to try cranberry juice for prevention of UTI, how much should they drink?
So in a recent article in Pharmacy Today, they recommend at least 36 milligrams of PACs daily. So a really good cocktail to drink or to take would be a mix of 300 to 500 milliliters of cranberry juice, and 400 to 800 milligrams of cranberry extract. And you can take that twice daily. So another way to look at it, 36 to 70 milligrams of cranberry PAC, is found in about 360 to 720 milligrams of cranberry extract. That's why when we say 400 to 800 milligrams of cranberry extract or pills, that's where we find the amount of the PAC that we need to prevent the bladder infection. So again, it is not completely clear what the most effective amount or concentration of PACs are that need to be consumed and for how long. But we do have some evidence that those cranberry products may reduce the occurrence of UTIs.
Great. So cranberry juice and together are preventative if someone gets reoccurring infections and they want to prevent them. But what about someone who already has a UTI?
Honestly, if someone already has an infection, I would recommend antibiotic medication to kill the bacteria and to prevent worsening infection of the kidneys and, the infection getting into the bloodstream. In some cases, the body is able to fight off the infection.
Okay. So in some cases, the UTI can go away because the body is able to fight it.
Yes.
Okay.
Yes. in some cases, in approximately 25 to 42% of cases, uncomplicated UTIs may resolve without any medical treatment. However, I would like to add that it is hard for patients to know whether they fall into that category, and in order to prevent worsening infection, most of the time we do that someone sees a doctor.
Yeah. So when would it be time for someone to see a doctor about their UTI?
Well, an uncomplicated UTI is when you have pain with peeing, but you don't have any other signs such as fever, chills, flank pain, abdominal pain, nausea, or vomiting. Those are all signs of a worsening infection. However, if you wait until you get those symptoms, it might already be too late to treat with just oral antibiotics, and you might need to be admitted to the hospital. That's why I usually say you should talk to your doctor as soon as you suspect having a UTI.
Okay. So for someone who's going to make an appointment but has not yet, is there anything they can do to manage the UTI?
Well, first of all, on MyVirtualPhysician, we're always available for emergent calls. So there's always someone available to help them and prescribe antibiotics as soon as patients need it. There's some other things that patients can do on their own. For example, staying hydrated, drinking plenty of water, that helps flushing out the bladder. It is always important to really empty the bladder completely when you go to the restroom. And, some adults have, a frequent urge to urinate or sensation of pressure, which makes it feel like they have to urinate, but not much is coming out. However, going to the bathroom frequently to empty the bladder can help. If there's pain in the lower abdomen, a heating pad might provide some help. And then over-the-counter pain medications such as ibuprofen or Tylenol can also help with the discomfort.
Dr. Masghati, you have shared some great information today. I appreciate you joining us for Talk Tuesday and helping us understand more about UTIs and cranberry juice. For everyone else joining us as well, this has been Talk Tuesday with MyVirtualPhysician. If you would like to connect with one of our board-certified OBGYNs, or for more information, you can check out our website at www.myvirtualphysician.com. We look forward to seeing you again, and we hope you have a great week.
Thank you so much.
The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem.